So you are welcome once again to Physiotherapy Hour. And today we are going to look at stroke. We have looked at the subjects such as arthritis, but today we are going to look at stroke. And stroke is a very vital topic that every household should be aware of and should do something at best to prevent it. Now, what is stroke? There are different myths surrounding stroke. In our locality, some people believe that stroke is spiritually motivated, is a sickness that people send to people. So many people believe it's spiritual. But no, it's not spiritual. Stroke is as old as man. So what is stroke? According to the World Health Organization, stroke has been defined as a sudden focal neurological deficit syndrome of presumed vascular origin lasting for more than 24 hours. If you look at this, it said it's an interruption to blood flow to the brain, resulting to damage to brain tissues. This is a typical presentation of the brain, the different hemisphere, as you can see. You see the posterior artery. The brain is supplied by various blood vessels. And if any of these blood vessels is compromised and you have resulting in a shortage of blood to any of the brain area, it will cause brain death to that area that is not supplied, and that is stroke will occur. Okay, so the definition, we need to look at it again critically. Number one, it is sudden. That means it happens unannounced. So it can happen any moment and it can happen to anybody. I will give us the risk factors later. So number one thing is that it is sudden. Because of the sudden nature, some people don't believe it is medical. So you can just wake up in the morning and it happens. Let me give you an example. One of my patients said he was making a phone call when he suddenly noticed that his hand could not hold the phone again. His mouth deviated to one side. He discovered suddenly that he couldn't lift his hand again on his leg. Stroke had occurred. Now, it is sudden and it usually affects an area in the brain. To find out that when you do an MRI scan of the brain, you'll find an area of infarct or area of hematoma, hemorrhage. You see an area where there is brain death, that's infarct, or an area where there is hematoma. Hematoma is clotted blood in the tissues. You'll find those areas. So, and of course, that's why I say of presumed vascular origin. And it must last for more than 24 hours. There are certain other conditions that mimic stroke. Most times, they are a pointer to stroke. For example, conditions such as TIA, transient ischemic attack. Transient means it is of a very short duration. What happens in that situation? You'll find that suddenly you could not make use of one side of your body, or you just went into a syncope, fainting syndrome, and you can't, but all of a sudden it is restored again. Okay, I had a patient that said they have been sending the stroke to him, it occurred to him 2 times. He didn't visit his native doctor on time. That the first time it happened, he did his own juju and it got reversed. Second time it happened, but by the 3rd time, sometimes that transient ischemic attack could be a pointer. It could be a warning sign that you are at a very dangerous stage, that stroke will occur at any time. So, but the difference between TIA and stroke is that TIA occurs within 24 hours. The whole situation is reversed to normal. You are back to normal, like nothing ever happened. But whenever you experience that kind of thing, don't assume that somebody sent it and your power was too much. No, it's a warning sign. Quickly go and see your doctor. So I'm going to be describing the types of stroke that we have. Okay, basically there are 3 basic types of stroke. The number one is the one we call hemorrhagic stroke. Hemorrhagic means bleeding. And so what happens? In the brain, the blood vessels are tiny as compared to other blood vessels in the body. And so once there is a break, once there is a tear, once there is a bursting effect to those blood vessels, for example, when the pressure passing through them is too high, it can burst and it will result in hemorrhage, it will result in bleeding. So the area of the brain that is bleeding, the distal part of it, you will not have blood flow to that area. So that is, if you look at this diagram, you will see one there, that is rupture. You can see where the brain, the blood vessel busted and the blood is seeping out. Now, because the blood is flowing out of this, the other end of the vessel, blood will not go there. So the brain tissue that is supplied by the other end will no longer get the nutrition that is required to carry out its normal function. So what you will have there is that brain, the brain tissue on that distal part will die, and that is stroke. That is the one we call hemorrhagic stroke. There's another type we call ischemic stroke. Ischemic stroke simply means that it was also starved of blood and oxygen. And what causes that is not because there's a bursting effect, but because there's a blockage. Okay, now what causes blockage? In the human body, there is a hemostatic process that takes place in the body that ensures that blood does not clot. But with time, as one grows older, or because of stasis, if you are staying in one place for too long, blood flow will be slowed, will be minimized. There are certain lifestyle also that you adopt, and it also causes this. And then blood begins to clot. So when the blood clots in an area, it is called embolism. Now, when that clot continues to grow, a time will come during flow or exercise or any activity, that blood clot could be broken off, and at that point it's called embolism. So we call it thromboemboli. So the clot that is broken off begins to move in the blood vessel. That is called emboli. Then when it gets to a place where the blood vessel is very tiny, as you can see here, it blocks, it can no longer move forward. It will now block that passage. So blood will not be able to flow to the distal part. And when that happens, those areas that it has blocked, that blood cannot flow to, it will starve those brain tissue of oxygen. And so the brain tissue there will die. That's another type of stroke. In this kind of stroke, most times, the blood pressure may be normal. So somebody can be maintaining a good blood pressure, but because of that blockage, and in fact, it's recommended today that once you are 45, age 40 and above, that you should be on aspirin derivatives such as Vasopressin daily, 75 milligrams. The sole aim of that is to prevent clotting of blood, okay, in the blood vessels. Now, I'm not going to go into details of how this occurs, but just know that this is the other type of stroke. Then the third type is the one we call aneurysmal stroke. Aneurysm means that, of course, the blood vessels, they are formed of different layers. Okay, so the different layers, there could be a tear within the layer. So when there's a tear within the layer, blood begins to seep into the layers, maybe the middle layer and the outer layer. Now, there's not going to be any bursting, but then the blood vessel itself will begin to swell. One of the things it causes is it will form pressure to the brain tissue. Okay, the swelling of the blood vessel will now constitute a pressure, a pressure trauma to the brain tissue. And most times, this type of stroke is very dangerous. In fact, most of the patients do not survive it. Not at all. Most of the patients don't survive it. Okay, so that is the third type of stroke. So you find that you can maintain a good blood pressure, but you still have stroke. The other one, okay, let me go to it now. What are the causes of stroke? For example, we have outlined the three major types of stroke. Let's take the first one, the hemorrhagic stroke. What are the main causes of hemorrhagic stroke? Number one is pressure. When your blood pressure is excessively high, the tendency is that the force could become too much for the arteries to bear, and so it could cause a disruption, a rupture of that artery. You know, if you have a tube, let's say a balloon, as you blow air into it, there's a point where it gets to. The balloon cannot withhold the air again, and so it will burst. That is the same thing with this issue. So when the blood pressure is too high, it could cause a bursting effect to the artery, and that will result in stroke. What other things can cause it? Aging. Okay, as one grows older, one, blood pressure increases. Two, the lining of the blood vessels begin to lose their elasticity, their capacity to expand and relax as one grows older. So what happens? It becomes much easier for this blood vessel to break, to cut. It's just like using a hose, a pipe. After some long time, you'll find that the elasticity of that pipe is lost. And so you begin to see crack and tear. Once there's any little pressure, you see that water begin to seep. That is what happens. The lining. Then the other thing are some inflammatory conditions such as atherosclerosis. So when you go to the hospital and they tell you don't eat some kind of fat, because as these fats, unsaturated fats, gets deposited within the lining of the blood vessels, it forms what we call a plaque. Those plaque is just like a dot, an injury on those vessels. Those plaques constitute a problem to the vessel, to the integrity of the blood vessel, and that can make it so easily give way to burst or to crack or otherwise. So, and that's what they call high cholesterol. Some people have heart diseases, okay, and some people have diabetes. Diabetes can affect your blood sugar, your blood pressure to be up or otherwise. Diabetes can also cause your lining, your vessel lining is also. Then the other one is, like I said, the blockage. Okay, the blockage, the tendency to have thromboembolic stroke, that's blockage within your vessel, is number one, inactivity. Okay, so for example, when you see patients that are on admission in the hospital for a very long time, it's recommended that they have physical activity, physiotherapy. Why? Because as you stay in a long time, take for example, the blood flow, the heart pumps the blood to all parts of the body. But what helps to return the blood to the heart is a passive process. There is no mechanism that pushes the blood back to the heart. The only mechanism that helps is what we call musculocutaneous pump, and that's what comes as a result of activity. As you walk, as you do things, your muscles are contracting and pressing on the blood vessels, and you know, as it's pressing, it's squeezing them so that it's able to return. As it's squeezing the veins, it's able to return the flow, the fluid in them back to the heart. Now, if somebody is in a sedentary position for a very long time, you see that that process is reduced. So what you have is what we call stasis, slowness in blood flow. Okay, so blood flow will become very slow. Now, the capacity to have been able to flush any of these things that are forming is lost, and instead the cells begins to coagulate, and before you know it, blood clots is formed. So sedentary lifestyle, and of course, which will come from the type of the occupation. Some people occupation is sedentary in nature, so that's why we recommend physical activities. What are other causes? I've said predisposing factors. Let's look at predisposing factors. There are things we call modifiable predisposing factors or risk factors, while some are non-modifiable. For example, age, you can't change it. Everyone must grow older. Age is a non-modifiable risk factor. So as you grow older, just know that you are at risk of developing stroke. Then, if you have a family history of stroke, that is genetic input. know that you are predisposed to having stroke. Your gender, I think the male gender is more affected, and then some ethnic groups are also found to be more affected. Then the modifiable risk factors are those lifestyle that you can change. For example, I've mentioned sedentary lifestyle. You can change your activity level if you are not active. Then if you have previous history of maybe TIA, of course you can see your doctor quickly for them to prescribe for you those things that can correct the cause of that TIA. If your blood pressure is high, it's modified. You can visit your doctor, take antihypertensive drugs, and the blood pressure will be reduced and controlled. If you have high cholesterol level, if you have heart diseases, if you are diabetic, all these things can be properly managed, and so the incidence of stroke will be reduced. So what treatment do we have for stroke? What are the treatments available for managing stroke? The first question anybody will ask is it true that when a stroke patient presents to the hospital and is injected, the patient may die or may not recover? It is a lie. That is a myth. I know in this area that is our belief, but it's not true. Okay, injection has nothing to do with stroke or syringe. It doesn't have anything to do with stroke. The injection they give you is to pass certain drugs that you may not be able to take orally directly into your system to help you either stabilize or otherwise. Because primarily, when you have stroke, the first thing you want to look at is what is the cause of the stroke. So when you go to the hospital and they are running different tests, they want to identify the cause. They also want to find out, are there other disease conditions that are underlying that stroke? Maybe is there heart disease, is there diabetes, are there other disease conditions out there? They want to find out so that they can manage you holistically. So the need for proper examination is necessary. Then your doctor may also ask you to go and take a scan, MRI of the brain or CT scan of the brain. They want to find out the actual cause of the stroke, if it's and the type, if it's hemorrhagic, if it is thromboembolic, if it's aneurysm, and then they want to also know the extent and the area of the brain that is affected, because the area of the brain affected will determine the manifestation of the stroke. For example, the speech center is in the left hemisphere. So when you have a stroke that is affecting your right side, the tendency for you to lose the capacity to speak is very high because there's usually a deposition. So if that speech center in the left hemisphere is affected, you may not be able to talk. So you see some of the patients, they can't talk. Now let me make this point very clear. Stroke is something every human being should fight to avoid, because the moment you have stroke, depending on the degree, your capacity to be able to depend on yourself is lost. You become dependent on people. You want to move your hand, you find out you can't move it. You want to move your leg, you find out you can't move it. Some people, they cannot even speak. Some, they cannot even sit. And once your independence is taken away from you, my dear, is a very terrible situation. And just like I said, everybody is prone to having stroke. How? I've told you one of the risk factors is aging. As you age, maybe as from 50, 55 upward, your chances of getting stroke is very high. So you must have a deliberate effort to watch after these factors that could predispose you to stroke. So everybody must watch out and see that because it is easier to prevent stroke than to treat it. Most times, once you have had stroke, you may never be able to return to your former state 100%. Why? Because brain tissues that are dead remains dead. They cannot come back. Yes, we have cases where we say brain cells regenerate. But research has shown that as it regenerates, that is how it also atrophies. So you may not be able to come back perfectly to your former self. But then what do we do if you have stroke? The aim of treatment first is to stabilize you. And if there's any other underlying condition, to treat it so that one, it will not cause another stroke. Two, so that it will not hamper your recovery. Then after you have been stabilized, maybe if it's a high blood pressure, you are giving some antihypertensive medications. If it's thromboembolic stroke, you are giving some drugs that will help to clean up the vessels of any form of coagulation. So you are giving those drugs that helps to dissolve blood clots and establish effective flow in the system. And then once you are normalized, physiotherapy takes its full course immediately. The physiotherapist's aim is to make sure that you return to independence as much as possible. That is our major goal. We want you to be able to do those things that you used to do. At least carry out your activities of daily living. At least be able to go to work if you are still working, and all the others. Because imagine I want to drink water and I cannot carry a bottle of water to drink. And I have to call somebody to come and give me the water to drink. Imagine how humiliating it will be. Even your most loved one will not be very pleased to be rendering that service to you the rest of his or her life. Because you're also tying the person down. You reduce your productivity level so much. So what am I trying to preach today? Prevention of stroke is very, very vital. Prevention of stroke. So like I said, the management, once you are stabilized, the physiotherapist wants to see how they can restore you to independence, to activity level. And physiotherapists use various techniques and modalities, which I'm not going to, is beyond the scope of this presentation. But one of the things we want to do is that we want to prevent deformities. There are some deformities that, because once there is stroke, there is a stage where we call a stage of spontaneous recovery. And that's why some people, if they go to native, they'll say, it's improving. No, with or without treatment, there's a stage of spontaneous recovery where you gain some recovery from the way you were. Most times when stroke happens, there's a stage we call a stage of neuronal shock, where the activities of the nerves is shut down. You can't do anything. Then after some time, you begin to gain some recovery. Okay, now if those people are native, they will say, they are gaining improvement. So we want to prevent various forms of complications and deformities that can arise. Various forms, the arthritis of the shoulder, of the knee, of the hip can arise. Then if they start walking, they develop what we call typical hemiplegic gait, which of course once you develop it, to correct it becomes very difficult. It's easier to prevent it. That's why early physiotherapy is very, very important. If they want to prevent arthritis that may develop in the joints, we want to prevent contracture, we want to prevent muscle atrophy or muscle wasting. So we want to maintain range of motion, we want to build up your muscles that are atrophied already. Then we want to now do what we call functional rehabilitation. We want to restore you to function, to functional independence. We want to see that you are able to go to your bathroom to take your bath, you're able to cook, and in some cases, depending on your capacity and the severity, we want to see that you're able to return back to your work so that your productivity level will not be totally exterminated. So that is primarily the role of physiotherapy, and we use different modalities, different techniques to restore that. Okay, I'm going to stop here. If there are any questions, please you can post in your comment section, and I'll answer you either individually or collectively. But I want to advise, as in summary, that please, every man, every woman is prone to developing stroke. I've listed for you the various risk factors for stroke. Stroke is not spiritual, and even if there are spiritual inputs, the physical manifestation of stroke is physical. Something happened in your brain, and then your functional capacity is taken away from you. Your muscles are paralyzed. You lose the capacity to use certain aspect of your body. And there is treatment for stroke. Don't resign yourself to the native, because I don't want to demarket anybody, but I must tell you from my experience, the native has no solution to stroke. It's a nervous problem. It's a neuromuscular challenge. It may not recover speedily, but you will definitely recover, at least to be able to do those little things, activities of daily living. And in some cases, you may recover fully back to your work. Thank you very much.